not like to take you all to the problematic areas which we are all facing. As I told you in the earlier deliberation for the question also, that every occupation, every profession has their own problems. There is no area of labor which do not include problems. So it's part and parcel. But what I mean is, there are a lot of problems which are faced, and in India per se, if we see particularly, there are diverse problems. There are diversities there in the problems as well. There is a disparity. First of all, there is a disparity of sector. If you see, the corporate sector, hospitals and corporate sector institutions, they are giving on par with the government sector services to the nurses. I mean. Okay, but if you see some of the private institutions and hospitals, there are a lot of problems which we can see. All the problems are lying there. Understand? So that is one obvious problem is disparity in the payment or the compensation which they get. Other than that, leave apart, that is external. But what internal problems which we face in the workplace, that is, first of all, as I rightly mentioned, we are 2.5% of all the laborers around the globe, and even in the health workforce, what we call health workforce or health team members, we are the 50% constituents of that health workforce. Nurses are 50% part. If there are 100 people, 50 are nurses involved into that health team member. So there is, 50 are required, but how many are currently there present? There are, there is a huge amount of shortage of nurses in India or in many of the sectors. Even government sector, if you also consider, there are not full-fledged recruitments which are happening. So ICN is urging to invest upon nurses and their well-being, so that these problems can be mitigated, controlled, and the outcome of the healthcare can be more quality-oriented. So other than these problems, workload is huge, demand is huge. One of the study done by ICN itself, it projects that there are, even WHO backs the information, that is 6 crore nurses are still required around the globe. 6 crore nurses are required. We are around 33 million nurses which we are working across the globe, and in that again 6 crore nurses are deficit. So you can imagine the country like India or certain underdeveloped countries per se, there is a lot of care gap, that frustrates the nurses, which a nurse wants to do many things but can't afford to do because there are external resource cut short or shortage of resources which are not appropriately provided to complete the task of nursing care. So it all in all puts health care into the danger by these things, lack of resources, or there are certain things, that burnout is another problem which all nurses are facing nowadays, and it is increasing day by day. Hope Madam agrees to my opinion. That once the nurse gets frustrated with all these amenities are lacking, the toxic work culture, it may be, or it may be poor compensation. In such scenario, what happens is nurse ultimately gets frustrated and nurse starts doing, the things which are like absenteeism or something called as presentism also. Presentism is a word which I could learn, very funny word, which tells that presentism is nothing but I am present but not mentally and all the way. I am not contributing anything, only physically I am present here. So such things like आपण मराठीमध्ये बोलतो पाट्या टाकणे. Hope you understand what I mean to say. So these kind of things will start working into that toxic work culture. So there are huge number of problems, and the solution for this is not temporary. There should be solutions which are strategically planned and which should be applicable for the long run, and that is here the investment into the nurses while they are taking admission into the nursing education itself. It should start. Now government is taking many steps. I hope most of the students are getting benefit of scholarships. So that is all the investment which government is doing upon nurses. You are a future nurse. So government is investing upon you, and you should see that these problems are tolerated by you, extra efforts are put by you with the gratitude of what help or what scholarship or what benefit you have got during your education. So all that matters to reach to the solution, and it's a global problem actually. It needs high involvement and well awareness of the problems with the government sector rather at the individual level. But individual level, what we can have the solution is like we should be satisfied with what we have, and we should try to improvise what we are, and that is year to year, not 10 years ahead we should think. So by that way we can mitigate these problems, I feel. But there are problems. Yes, sir.
One question. I just want you to share your experience when you are working outside. Because in outside also we are facing many of the challenges, and whether these hurdles are taken care properly outside also.
Yes, I have served in East African country for 4 years as a lecturer for College of Nursing. During that time, I observed that there also even all the nursing fraternities are not well paid. That payment is the first issue, which is observed there in Eastern Africa as well. Even in European countries, if you see nowadays, there are a lot of problems which are involved in terms of pay scale, okay, pay band, which they are offering. And what is the reason for that? Like one of the survey which depicts that there is stagnation of pay scale all over the world. There is a stagnation. There is no hike of payment in relation to the inflation of the country. The inflation is rising, but the income source of nurses is stagnated from 2020-21. There is a stagnation in the increments. So that is affecting, not everywhere, but many countries they are having this issue. That is one thing which makes the life miserable there. And we all look to see that somebody is in abroad, so they are happy, they are earning lakhs together. We feel that, but the taxation which they pay, and at the end of the month, what they could save, that matters a lot there. And only the lifestyle of being in Western countries or American soil, we can enjoy those lifestyle. But ultimately, that all problems, like loneliness and isolation and missing out from the occasion which is happening in our home country, those all can be missed, and that frustration which brings out, that is miserable actually. No one should have that misery. It means like, we miss out the family members, okay, we miss out many occasions. So these are all problems experienced by a nurse who is in abroad. Okay, and the other one is, what is happening is these Western countries and USA, what they are doing is they are trying to fulfill the deficit of nurses into their country, because they are very serious about the number of nurses which they need, because they can't afford to excuse the shortage of staff, because the huge amount of tax the citizens pay out there, and they have to get it is their right to get the health care appropriately. So this NHS and all nowadays, what they are doing, they are only to increase, the sake of increasing the number of nurses, they are recruiting, rampant recruitment is happening. There are a lot of compromises which are taking place, and hence the quality product is not obtained by them also. And in return, what happens, another problem which we face there is, earlier Indian nurses were good, but now that has gone down. Why? That is because the internal problems are there, that is apart, but the nurses which are recruited by international authorities or national health organizations, they are all little compromising in order to, or with the only sake of increasing the number of nurses. So these are the issues which can be observed abroad as well. Thank you.
Yeah. I would like to put it as 3S. Okay. The first is the shortage of nurses, which already was mentioned. Yes, we are really shortage we really are having struggles in the hospitals. Ideally, one nurse is supposed to take care of 5 to 6 patients, where sometimes in the hospitals it's like 40 patients are taken care of by one nurse. That bad is the shortage. Now, what happens because of the shortage? Yeah, patients are supposed to get medicines on time. One nurse, how much can she run around to ensure that each patient optimize healthcare, okay? Because we are not investing more on nurses, because we are not recruiting more nurses, we are not able to pay them and do it. And because of all this frustration of one nurse trying to do everything, what happens to the nurse? She's getting totally stressed out. Stressed out that she's not, at the end of the day, she doesn't know what she's done, what she's not done, and she's feeling bad that she's done some mistakes also again as she's trying to do things. So she gets so stressed that she's also developing health issues, okay, or the nurse is developing health issues and not able to actually do a good job again. And another very important thing that I found especially in our country, is the stigma associated with nurses. I would like to ask a question. How many of you all have voluntarily taken up nursing? How many? Yes, I want to become a nurse and therefore I am not. Hardly. Why is it? One could be the stigma attached. I still remember when I decided to become a nurse. It was out of my own interest that I said I want to become a nurse. And I went down south. This was just soon after I finished my 12th. My grandma was asking, what do you want to do now? You finished your 12th, what do you want to do? I said, I want to become a nurse. And the immediate expression was, nurse? That is the stigma that is attached. That respect is not there for nurses. Yeah. So that respect is not there. Whereas abroad is the opposite. I have some, my parents have friends abroad. And the way they say is that, oh, what a nurse. And that warmth, that feeling of respect that you get is different. So that is something that in India we need to try and improve the status of nurses. Okay, so that it's not like we are just assistants. We are doing a 4-year course. We are equivalent to a doctor. We are knowledgeable. We know it. But what we do, we don't show it or we don't express it. We try to run away from the situation. When there is a decision that has to be taken, we say, okay, let the doctors do. It's not my part. Why? We need to just take it up. We need to ensure that we are part of the health team. We have an equal say in whatever is happening to our patients. Include ourselves in the decision-making process, and thereby we will get that respect. We should, whatever opportunities come, we should take it up and show forth. Critically analyze the situation, assess the patient, inform when it has to be. Yeah, I still remember one of my student nurses. It was in a maternity ward. Suddenly after the delivery, postnatal was having some breathing difficulty. She immediately identified and shifted the patient to ICU. Nobody, no other staff nurse was there. Just a 4th-year student who immediately took that action and saved the life of the patient. Because she was shifted, they were able to immediately intervene and take care of that what happened. So that's where we are, when we do such things, when we start talking about even about health teaching, so many things we know. Let's tell it out to the patients. So patients will know, oh, PhD nurse, but they know so much. The doctor didn't tell me all this, but the nurse has told me so many things. That's how we are able to improve our status in our country, especially in our world. Another problem which we find is the brain drain, where all our good nurses, they fly. Most of the, and once they go there, they are taking up high positions, leadership roles, decision makers, and they are doing a lot of good job there in other countries, whereas India is losing all that. So that's again another bigger challenge in our country. Yeah, I think anything else?
Yes, sir.
In addition to this, actually, मैं क्या बोलना चाहता हूँ, लाइफ में प्रॉब्लम होना चाहिए, बिना प्रॉब्लम लाइफ क्या होगा? तो अगर लाइफ में कुछ प्रॉब्लम है तो तभी थोड़ा इंटरेस्ट रहता है. सी, we and Bahubali sir actually both work together in Ethiopia as in Eastern African countries, where his university was different, my university was different. When I landed in Ethiopia, first after 3-4 days, I felt okay, everything is fine. Okay, now I can run my life. ऐसे सोच के वहाँ पे काम करना start किया. But starting the initial time itself, 15 days, no water, no power. How to live? That people are very much happy. They don't have any problem. They are very happy. They are leading the life. But I came from the India, and it is completely new to me. I don't know how to live without water and power. उस दिन मुझे पता नहीं क्या करना है. Then I called to my wife. I told her I will come back. She said no, you stay back another 3-4 days. If you can't adjust, then you come back. Then okay, 3 दिन चला गए, 4 दिन चले गए. मेरा एक सीनियर मिला. सीनियर ने बोला कुछ मत करो और 10 दिन एडजस्ट करो, पावर आ जाएगा, पानी भी आ जाएगा, और एक 15 दिन एडजस्ट करो, सैलरी आ जाएगा. सैलरी आने के बाद सब कुछ भूल जाएगा. So very simple. Yeah. See, after the 1 month, when I get 1,25,000 salary in my hands, I was very happy. Then I forgot all 15 days power, all okay. जो भी पीछे था वो सब कुछ मैंने भूल गया. See, मैं क्या बोलना चाहता हूँ, से लाइफ में प्रॉब्लम के बिना we can't live, and every professional have their own problems. As madam said that shortage of nurses, more work, less salary, like this, even nurses also have challenges. What we need to do, we need to understand what are those challenges, how to combat those challenges. Okay, just 2 days before I was talking with one of our ex-students, JNM students. I asked her how going on, कैसे चल रहा है सब कुछ. Then she said, no sir, मुझे थोड़ा क्या है, कंप्यूटर में डेटा एंट्री करना नहीं आता है. मैंने बोला ऐसे क्या है, मोबाइल यूज करते हो तो कंप्यूटर में डेटा एंट्री करने में क्या प्रॉब्लम है. नहीं सर, मोबाइल अलग है, कंप्यूटर देखकर तो थोड़ा डर लगता है. नहीं, it's a see nowadays all the hospitals are implementing the technology, means they are using the computers to convey the information to the patients and even to the doctors and the healthcare professionals. So we need to equip with that one. We need to learn how to enter the data in the computer, so that definitely we can adjust with such problems. So like that, we need to understand those problems. We need to learn how to combat those problems. Then only we can lead a good life in the profession. So this is my thank you.
Yeah, even when I was in Ethiopia, the place which we got to work there is, their national mental health policy allows psychiatric nurses to practice and consult the patient. So, which I did not observe here in India. When we say psychopharmacological drugs, we stay away from it. But I got a orientation, I got a training, I got a translator to consult the patient, and these kind of opportunities were given there. Because of shortage of psychiatrists, the psychiatric nurses are promoted to be a consultant. So these kind of opportunities are also there. It doesn't mean that, as sir said, कि problems रहना चाहिए. Problems नहीं है तो फिर क्या है? There is no life. So उसमें ही struggle करना है, उसमें ही opportunity ढूंढना है, उसमें ही बाहर आना है. That is what all about the nursing also. As you all are budding nurses, you should take this in a sportive way, that there are problems existing, but we will try to adjust, we will try to reform, we will try to lead the problem and solve it. So this is the positive note which we can add up to the problems which can be identified in India.
Okay, Rajendra sir also pointed out the importance of salary. Salary also matters a lot. But when we are facing the shortage of nurses, still the nurses are working hard for the patient. Then also we cannot see the fair payment for our nurses. In the state-wise also we can see not a standard paying scale for the nurses. So, Rina sir, how can, in your view, how we can overcome this, and what is your opinion regarding the payment of the nurses?
See, in regard to the payments, frankly to say that, especially in South India, after the completion of a BSc nursing or JNM nursing, when you go to the clinical job, so what I have seen that I am telling you, so it may be different from our sir opinion. जो बच्चे BSc खत्म करके JNM करके हॉस्पिटल में जब गए, their initial salary was just 5,000. Same if you take the BSc or JNM completed students in Delhi and surrounding UP and area, they definitely get minimum 18,000. Look at the difference between South India and North India. There is a lot of difference. see it इसमें किसका मिस्टेक है, इसमें किसको हमें ब्लेम करना है, we don't know. So my opinion is that they should be sick. Madam is one of the ANI member and she is one of the recognized faculty of India. So I would like to request to those Indian Nursing Council or International Nursing Council or any regulatory bodies, they should come forward, they should make some a common statement or something, resolution in the Indian political system that minimum should salary should be kept for all the nurses all over the world, so that we can solve this type of problem. Second, okay, this problem is there. Now second is, sir said that we must be equipped ourselves. See, when you people are talented, when you people are skillful, so definitely you have plenty of opportunities to shift to that, so where you can get a good amount of salary. So अगर आपके पास एक अच्छा स्किल, अगर आपके पास एक अच्छा नॉलेज है, definitely you can shift to the another hospital where they provide a very good salary. So definitely you can lead a life. So overall बोले तो this is actually management के अनुसार ये थोड़ा सा है. It's bit tough to control in India and in some countries also. Last year we might have seen in West and other Canada countries the nurses were started strike. So they were asking to the government that we must get minimum amount of salary, then only we work. ऐसे तो salary के बारे में तो हर जगह पे थोड़ा प्रॉब्लम है, वो तो है. अगर आप लोगों ने एक अच्छा स्किल या नॉलेज है, then definitely you can enter into the competitive world. There you can get a very good salary and definitely you can uplift the life. So that I would like.
Because our nurses are underpaid, that is also affecting again it's like a vicious circle. Yeah, exactly.
which we are trapped into.
Yes. So, most of them are, the nurses are the women. They already have enough work at home. And after all that work, and you're somehow managing to reach your workplace, and you're just getting hardly any money, then it's like, what's the point of working? Might as well sit at home. So there are many nurses who, in spite of being educated, say, okay, it's not worthwhile because they're not getting enough. There's anyway, might as well take care of the children, take care of the home things, and because at the end of the day, you're not getting anything. So that's again adding to the shortage of nurses. So once if I'm happy that the government of Maharashtra has realized that in the government they are really paying good. I've heard that even starting salary for an A&M nurse is like 40,000. It's really wonderful to hear that. So that's good that the government is trying to do it so that they can retain more nurses. Once the nurses are happy, and even in the workplace, it's along with the salary that privileges like leave facilities, a little flexibility in the work environment. That whole environment also can help in retaining nurses and thereby having a kind of a ambience to work, that feeling of work is increasing. That would help in retaining nurses and thereby the output of the nurses would be better because then if the stress levels are reduced, that will again help in providing better care and giving out of our own. It's not just okay, it's my work. It's that passion that drives you to do. Then it becomes a lot more.
Yes. In terms of salary disparity or the inadequacy of compensation, financial compensation especially, which moderator would like to seek it, I would say this question is little tricky, like it's very much complex problem. As madam said, it's a vicious cycle, never ending cycle, and we are trapped into. म्हणजे आपल्याला पेमेंट कमी मिळतो म्हणून आपला एफर्ट कमी पडतो, आपला एफर्ट कमी पडतो म्हणून तो तिथून येतो मॅनेजमेंटला, त्यांनी मन करणार नाही तुम्हाला जास्त पेमेंट देण्याचं, तर परत त्यांनी पेमेंट देत मग परत आपण एफर्ट कमी करतो. दिस इज अ सायकल विच इज गोइंग ऑन आणि त्यात आपणच अडकलेलो जाळ्यामध्ये. आता हे सॉर्ट आउट करण्यासाठी मला ऑनेस्टली वाटते की हे कुठून यायला पाहिजे तर राईट फ्रॉम आता फॉर एक्झाम्पल कॉलेज ऑफ नर्सिंग गव्हर्नमेंट शुड इंट्रोस्पेक्ट अँड सी दॅट की एक स्टँडर्डाइज पे स्केल केला आणि त्याचा खर्च किती येतो, त्या इन्स्टिट्यूशनला किती खर्च येणार आहे, कारण मॅनेजमेंट कुठून पेमेंट देणार आहे, त्यांना जेवढं स्टुडंट फीस किंवा जे काही रेव्हेन्यू जनरेट होतं त्याच्यातूनच त्यांना द्यावं लागणार आहे आणि त्याच्यात वर्कआउट होत नसेल तर ही कान पे, कोण खिशातून पैसे काढून देतील ते स्वतःचे, त्यांना 4 पैसे राहिले पाहिजेत आणि बाकीचे फॅकल्टीना दिले पाहिजे त्यांचं सॅलरी. हाच उद्देश असतो ना कुठल्याही फर्मचा किंवा बिझनेसचा किंवा व्हॉट वी से इज sector which works for something, they expect some profit and out of that they can give it for all the employees and it can be as a terms of salary. पण इथे कुठे आपण मला ऑनेस्टली वाटतं की आपण बेसिकच एस्टिमेट करून की स्टुडंटना फी पण तेवढी करावी लागणार आहे आणि स्टुडंटना हा बुर्धन होऊ नये. स्टुडंट्स नीड नॉट टू वरी अबाउट ऑल द पेमेंट टू बी पेड. गव्हर्नमेंट कॅन हेल्प. गव्हर्नमेंट हॅज लॉट ऑफ हेल्थ एक्सपेंडिचर म्हणून त्यांनी खूप मला वाटतं गेल्या फायनान्शियल बजेटमध्ये सेंट्रल गव्हर्नमेंटने 9,000 करोडच्या वरती हेल्थ केअर एक्सपेंडिचर म्हणून काढलेलं आहे त्याने फॉर द हेल्थ केअर वर्कर्स. म्हणजे जे काही आपल्या जीडीपी मधला जो म्हणजे 3 ते 4% भाग जो हेल्थ सेक्टरसाठी दिला जातो त्या 3 ते 4% मध्ये बऱ्याचसा वाटा तो आरोग्य सेवकांच्या आरोग्यासाठी पण ठेवला जातो, तरतूद आहे त्याच्यामध्ये आणि ते पैसे त्यांनी स्टुडंट नर्सेसना त्यांना फी सवलतीमध्ये किंवा स्कॉलरशिप माध्यमातून देऊ शकतात आणि इट कॅन बी कम्पेन्सेटेड बट whereas the faculties will get the full-fledged salary which is expected. आता तुम्हाला माहिती असू दे मॅम, you might also be aware about it. You know, like southern faculties from many college of nursing from South India, they started mass campaigning signature and they have drafted letter to Indian Nursing Council also by stating that why there is a disparity in the salary. Whereas आपण imagine करू शकणार नाही आहे as a professor, as a principal, hardly they are getting 40,000-50,000 in Tamil Nadu. This is very shocking to hear that they are putting in all their effort as a head of institution, so called as head of institution, and they are getting 50,000. This is too less. But now everybody has realized, and there should be some movement which can address this issue to the government. Government should think over it, and there are many intellectuals, IAS officers, administrative officers are there. They let them think and come out with certain strategy which can uplift all our basic need, what we say as a salary. That's all.
And as you said, the nurses are the backbone of the healthcare system. They are really working hard to reach the remote area and trying to reduce the gap in the healthcare system. So how better we can support these nurses by some policies and changing the system also?
Okay. I think that's 4 P's for a, I don't know whether any of you are making notes on it. You can, it's easy to remember. The first P is the pay, the second is protection, third is promotion, and the fourth is participation. Pay we had already discussed, I'm giving that. Coming to protection, the nurses who are working in the hospitals, they need to be protected. Protected in the sense of, one of the very important things is gloves when you are giving care to patients. Universal precaution says that we need to wear gloves for any invasive procedure, anything where we are coming in contact. But we don't have those. So we need to protect the nurses. So during the COVID, I would like to tell a story about what happened during the COVID. All other? Yes. Okay. So being an Indian Red Cross Society, during the COVID, we didn't send all our students back home. But we had to, other hospitals were asking us for help from the nursing college. So we had sent our senior batches we sent to one of the hospitals to help them out. I went along, dropped them, and then I told the authorities, you need to, and I told the students, one important thing, you need to ensure that you have your PPEs before you enter into the COVID ward. Because they're going specifically, they're deployed there just to give care for the COVID patients. And I told them, if you don't get your PPEs, just let me know, or you're not going for work. So the next day morning, I got a call from the authorities. PPEs, then they will come home. From the next that day onwards, every day the students got their PPEs and they were happily working almost 1.5 to 2 months. I'm not remembering the exact duration. They worked there and then a day came when we had to bring them back. We said, ma'am, the students are saying, ma'am, if you have to go back again, we're very happy to go. The same students, why were they happy to go? Because they were taken care of. So once you protect them, then we can also expect work from whichever level. I'm just telling as an example of the students. It holds good for everywhere. So as nurses, we need to get the resources, whatever is necessary, to ensure that we are protected from the other diseases and we are able to provide adequate care for our patients. The third is the promotion. Now in our nursing career, we need to have good that ladder, career ladder. Even if it's a GNM nurse who started working in the hospital, she needs to get some incentives as she, maybe something of doing her PPPSC, and then an incentive for doing a PPPSC, some post or some responsibilities, so that will make one feel happy. So that kind of a promotion will change the situation. Then another thing is participation. Participation, again, making everyone feel that you are important in that particular organization. So, in decision making, when you do anything in the world, okay, asking the opinion of the nurses also. It's not only, nurses are very creative, very knowledgeable, even without anything they can make something. You agree with me? Yes? I remember when we don't have these adequate, to protect the patients from bed sores, we blow these gloves and put it as, yeah, it's a very interesting way. It's a situation in the world. Or another thing like even giving balloons to children after a surgery. It's a small way. So these are small things that nurses also get, where they are putting their input into the patient care. I remember again during the COVID time in Bel Air, Father Tommy, our director, he called for a meeting. Interestingly, this was soon after I joined, I think hardly few months after I joined Bel Air. And I was looking, he did not call any doctors. We had the nursing superintendent, the principal, the lab people, the administrators, everybody was there in the meeting. And he was asking us our opinion about how to go about. COVID is increasing, should we open our doors for COVID? So he allowed us to give our opinion, what we can do. Even setting up the COVID wards, how to go about trainings, a lot of initiatives, we as nurses, very good. And that gave us a lot of joy in contributing and that participation. So the more we are part of the whole thing, in whichever level, in different levels, policy making, decision making, in every way, if we are part of it, then that would really help us in putting ourselves into and giving ourselves completely into the profession.
मॅम मी मराठीमध्ये सांगायचा प्रयत्न करतो थोडं. मॅडमने जे सांगितलं खूप सुंदरपणे की पार्टिसिपेशन म्हणजे ह्याला काय म्हणतो, सहभाग करून आपण निर्णय घेण्याची क्षमता आपल्याकडे पण देणं, हे जर आपल्याला मिळालं तर आपण खूप काही करू शकतो. बरं, आता एक इंटरनॅशनल काउन्सिल सुद्धा म्हणतं, इंटरनॅशनल काउन्सिल फॉर नर्सेस सुद्धा म्हणतं की आपण सगळ्या अडचणी घेऊन एवढं चांगलं काम करायला लागतो जगामध्ये. आणि जर समजा आपल्या सगळ्या अडचणीमधल्या जे मूलभूत गरजा जे प्रॉब्लेम म्हणतोय आपण, त्या सगळ्या जर कंट्रोल केल्या तर आपण किती छान काम करतो. हा याचा एक उदाहरण. आणि असं मॅडमने सुद्धा म्हटलं की आपण पेट्रोल प्रिव्हेंट करण्यासाठी जेव्हा काही साधनं नव्हती त्यावेळी आम्ही ग्लव्ज फुगवायचो आणि जो प्रेशर पॉइंट आहे तिथं तो ग्लव्ज, तिथं फुगवलेला ग्लव्ज तो ठेवायचा, जेणेकरून तो पेट्रोल होण्यापासून प्रिव्हेंट होऊ शकतो. अशा पद्धतीनं जे आपण करत आलेलो आहे, आपली पिढी जी आतापर्यंत आलेलं आहे, आता तुम्ही बघाल तर असं कसं करू शकताय. तुमच्या मनात सगळ्यांच्या मनात सहज येऊ शकते की असं कसं होऊ शकते. पण आपल्याला एक मूलभूत तत्व शिकवलेलं आहे आपल्या नर्सिंगमध्ये की युटिलाइज द अवेलेबल रिसोर्सेस बट डोंट फॉरगेट द प्रिन्सिपल ऑफ नर्सिंग. म्हणजे त्याच्या मागचं रॅशनल विसरू नका, पण ज्या गोष्टी आपण करू शकण्यासारख्या आहेत त्या अवेलेबल रिसोर्सेस पासून कसं करता येईल याच्याकडे आपल्याला लक्ष द्यायचं आहे. ते ही पिढी सुद्धा हेच जोपासना करणं किंवा पुढे घेऊन जाणं हे खूप गरजेचं आहे. इथं विसरून जाऊ नका आपण मॉडर्न नर्सेस आहे, पण आपण कशा तऱ्हेनं असलेल्या साधनामध्येच कसा वापर करून आपण ती गरज भागवू शकतो, पेशंटला कशा तऱ्हेनं आपण कम्फर्ट देऊ शकतो, केअर देऊ शकतो, हे आपलं लक्ष असलाच पाहिजे. आता भलेही तुम्ही ग्लाउज बघून ठेवू नका, पण whatever way you can do, you should do it with the available resources. हे मला सांगायचं. आणि आता मी मॅडम कॉलेज ऑफ नर्सिंगला ट्युटर असताना अराउंड 2006-07 मध्ये फर्स्ट इयरला मी आयव्ही म्हणजे स्काल्पेन कसं इन्सर्ट करायचं शिकवत होतो. तर त्यावेळी मला आपल्याकडे काय थोडं लॅब नाही किंवा मॅनिक्युअर नाही किंवा जे सिम्युलेशन लॅब असतो त्या प्रकारचा स्किल लॅब तुम्हाला सगळ्यांना जे मिळणार आहे येणाऱ्या दिवसामध्ये असल्या गोष्टी काही नव्हत्या त्यावेळी. तर मी काय केलं, एखादा म्हणजे आयव्ही बॉटल असतो ना तो घेतला आणि तो स्काल्पेनचा जो सॉफ्ट फनेल असतो ना त्याला मी आत त्याला चिकटवलं असं वेन सारखं आणि त्याच्यावर टिश्यू पेपरनी रॅप केलं आणि तो इट वॉज जस्ट अपिअरिंग लाईक अ स्किन. सो मग त्यातून स्टुडंटना प्रिंट करायला शिकवलं. म्हणजे अशा गोष्टी आपण साधनांचा वापर करून आपण करायचा आहे. त्यावेळी गरज होती तसं केलं. आता जी गरज आहे ती आपण करत जायचं आहे. म्हणजे ऑल इन ऑल काय सांगायचं आहे, तर जे साधनं अवेलेबल आहेत ते हे करायचं आहे मला, हे नाही आहे हे करू शकत नाही असं म्हणण्यात अर्थ नाही आहे. असलेल्या साधनामधून मी ते कसं करू शकतो याच्याकडे लक्ष आपलं असलं पाहिजे. हे सगळ्या स्टुडंट नर्सेसना मॅडमनी पण सांगायची इच्छा तेच आहे की आपण हे सगळ्या गोष्टींचा वापर करून हेच पुढं कंटिन्यू करायचं आहे. ठीक आहे, तर दॅट इज वॉट. आणि मी काही आर्ट्स पण निवडले. ओके, देर आर 6 आर्ट्स ॲज आय सेड. मॅडम सेड अबाउट पीस, यू नो, लाईक व्हॉट आय मीन इज व्हॉट नर्सेस कॅन गेट टू डू बेटर. इट वॉज अ बेसिक क्वेश्चन. तर काय करू शकतो, तर सगळ्यांच्याकडून म्हणजे जे सामान्य लोक, कम्युनिटी किंवा पब्लिक ज्यांना म्हणतो, स्टेक होल्डर्स असतील, मॅनेजमेंट असेल, गव्हर्नमेंट असेल, काय केलं पाहिजे त्यांनी नर्सेसना, जेणेकरून नर्स जे चांगल्या तऱ्हेनं काम करत आहे ते अजून चांगलं करू शकेल. तर तिथं काही मी आर्ट्स निवडलेले आहेत, जसं रिवॉर्ड. ओके, आपल्याला रिवॉर्ड जसं मॅडमने म्हटलं आपण अंडर रिकग्नाइज्ड आहे, इनविजिबल आहे. आपण जेव्हा इनविजिबल मधून विजिबिलिटीकडे येतो ना त्याच वेळी आपल्याला आपलं महत्व काय हे जगाला पटणार आहे. यु नो, वी आर अंडर शॅडो ऑफ डॉक्टर्स or medical professionals, other medical professionals, that we did not do, as rightly said by madam earlier, that we should come up. ह्या challenges घ्या, जे स्वतः पुढे येते ते करा, तुम्ही करून दाखवा. म्हणजेच तुमचं ॲज अ नर्स दे विल अस्टॉनिश टू सी दॅट नर्सेस आर ऑल्सो दिस मच. हे आपण करत नाही, कारण आपल्यामध्ये सबमिसिव्हनेस खूप आहे. हे थोडं मला दुःख वाटतं सांगण्यात की आपण सबमिसिव्ह होतोय. सबमिसिव्ह याचा अर्थ काय की कोण काय म्हटलं की शांत बसतो. त्याला काय करू शकतो, त्याच्यापासून पुढं काय शिकून आपण त्याच्यात काय चांगल्या प्रकारे करू शकतो, ह्या गोष्टी आपण थोडंसं लॅक करतोय. तर स्टुडंटना हे विनंती आहे की डोंट बी सो सबमिसिव्ह. ओके, व्हेन यू आर एट फॉल्ट यू बी ऍक्सेप्ट दॅट फॉल्ट, बट व्हेन यू आर नॉट ॲट डोंट ट्राय टू लर्न, ट्राय टू एक्सप्रेस, बी असर्टिव्ह. ओके, सो तशा घटना घडल्यानंतरच आपल्याला रिवॉर्ड मिळणार आहेत. आणि असं नाही की रिवॉर्ड हा एकच शब्द अशा तऱ्हेनं देऊ शकतो, पण असल्या दिवसामध्ये लाईक इंटरनॅशनल नर्सेस डे दिवशी let us felicitate a nurse who has done incredible job of service or some adventurous work she has done. So let us honor them as even government of India does. Okay, आपल्याला प्रेसिडेंट कडून सन्मान सुद्धा मिळतो नर्सेस डेच्या अनुषंगाने. तर तशा गोष्टी आपण लोकल लेवलला सुद्धा सुरुवात केली पाहिजे. आपले समाजामध्ये लोक जे लीडर्स आहेत ना त्यांनी बोलवून सन्मान केला पाहिजे आजच्या दिवशी. ह्या रिवॉर्ड्स जर मिळायला लागले तर नर्सेसना खूप पाठबळ मिळणार आहे आणि खूप ताकद मिळणार आहे समाजाकडून आणि ते खूप चांगलं करू शकतात. दॅट इज रिवॉर्ड. सेकंड इज रिस्पेक्ट. ॲज इट इज ऑलरेडी डेल्ड विथ. आपल्याला रिस्पेक्ट कसं, आपण कुठल्या स्टेजमध्ये आहोत, आपला इमेज काय आहे, हा खूप बदल झालेला आहे. अराउंड 20 वर्षामध्ये खूप काही बदल झालेला आहे, पण अजून थोडंफार त्याच्यावरती काम होणं गरजेचं आहे. तो स्टिग्मा घालवायचा आहे आणि आपल्यावरती जो आदर निर्माण झाला आहे पॅन्डेमिक मध्ये नर्सेस बद्दल तो आपल्याला राखून ठेवायचा आहे. त्याच्यामध्ये वाढ होणं गरजेचं आहे. त्याच्यामुळे नर्सेसना चांगलं काम करण्यास संधी मिळू शकते. आणि रिसोर्सेस जे साधनं लागणार आहेत नर्सेसना ते दिल्यामुळं खूप इफेक्टिव्ह केअर होऊ शकतो आणि ऑल इन ऑल इकॉनॉमीला खूप बूस्ट मिळू शकतो. तो वन टाइम इन्व्हेस्टमेंट लागू शकेल गव्हर्नमेंटला किंवा स्टेक होल्डर्सना, पण त्याच्यातून खूप फायदा होणार आहे. म्हणजे पेशंटचा स्टे कमी होईल, चांगला केअर मिळेल, लवकर रिकव्हरी होईल, पेशंट लवकर घरी जाईल, त्याच्यामुळे त्याचा कॉस्ट वाचेल. ओके, ऑल दॅट. अँड अशामुळं काय होतं की खूप साधनं दिल्यामुळं, व्यवस्थित साधनं जे गरजेचे आहेत ते दिल्यामुळं खूप नर्सेसचं काम सुरळीत होईल आणि क्वालिटी काम सुद्धा होऊ शकेल. आणि रेव्हेन्यू ॲज लाईक पेमेंट असेल किंवा वेलबिंग वेलफेअर ऍक्टिव्हिटी असते किंवा एक इन्शुरन्स, हेल्थ इन्शुरन्स असेल किंवा ट्रॅव्हल अलाउन्स असेल, ऑल दॅट रेव्हेन्यू कॅन बी ऑफर्ड टू नर्सिंग फॅटर्निटी सो दॅट इट लीड्स टू गुड वर्क पॉवर. देन रिलॅक्सेशन. आता हे सगळं हेक्टिक शेड्यूल आहे, बरोबर आहे, शॉर्टेज ऑफ नर्सेस आहे, बरोबर आहे, त्याचा मार्ग अजून खूप क्लिष्ट आहे, कॉम्प्लेक्स आहे, पण त्याच्यासाठी आपण काय करू शकतो, असलेल्या वेळेमध्ये जे रात्र दिवस काम करायला लागतं त्याच्यामध्ये थोडं रिलॅक्सेशन असणं गरजेचं आहे. हे इंडियन लेबर ऑर्गनायझेशन सांगतं की जो कोणी प्रोफेशनल 12 तास कंटिन्यू काम करतो त्याला 24 तास हे फ्री वेळ मिळाला पाहिजे, आणि जर 6 तास काम केलं तर पुढचे 12 तास त्याला निवांत मिळाला पाहिजे. 12 तासांनीच तो परत ड्युटीला जॉईन झाला पाहिजे. म्हणजे त्यांच्याकडून मिनिमम स्टँडर्ड आहे, पण आपल्या देशामध्ये खूपच शॉर्टेज आहे नर्सेसचा, त्याच्यामुळे आपल्याला खूप वेळा ओव्हर ड्युटी करावी लागते. तो वी आर लिटल टायर्ड, सो रिलॅक्सेशन इज व्हेरी इम्पॉर्टंट इन बिटवीन. आता एक महिन्यामध्ये एक स्टडी सुद्धा सांगितलं जातं रिसर्च की त्यांनी झुंबा सगळ्यांना माहिती आहे ना, येस, तो सो दॅट हॉस्पिटल विच इंट्रोड्यूस्ड झुंबा फॉर नर्सेस ड्युरिंग द वर्किंग आवर्स. आता काही कोविडच्या वेळी सुद्धा बघितलं कॉर्पोरेट वर्ल्डमध्ये सॉफ्टवेअर इंजिनियर सगळे त्यांच्या टेबल चेअरला सोडून ते बाजूला डान्स करायला लागले. तर तशा गोष्टी पाहिजेत ऍक्च्युली. दॅट हॅज प्रूव्ड टू बी, रिसर्चमध्ये असं दिसून येते की दॅट इन्क्रीजेस द कॉग्निटिव्ह ऍक्टिव्हिटी ऑफ नर्स. म्हणजे मेंटल प्रेझेन्स असेल, त्यांची क्षमता असेल मेंटली फंक्शन करण्याची, जे मेमरी म्हणतो, ओळखण्याची पद्धत, अटेन्शन, कॉन्सन्ट्रेशन, या सगळ्या गोष्टी वाढतात त्याच्यामुळे, आणि फिजिकल स्ट्रेंथ वाढतो उलट, आणि रोग निरोधक शक्ती सुद्धा बूस्ट होते, असं त्यांच्या स्टडीमधून ते आढळून आले. तर तशा गोष्टी दिल्या पाहिजेत. स्ट्रेस बस्टर्स त्याला म्हणतो, थोडं गप्पा मारणं 1-2-4 मिनिटं, ओके, ह्या गोष्टी झाल्या पाहिजेत. ह्या म्हणजे थोडं जे नर्सेसचा जो काही केअर घेतला पाहिजे तो मिनिमम केअर तरी मिळाला पाहिजे सगळ्या नर्सेसना, जेणेकरून म्हणजे रिलॅक्सेशन आणि रिफ्रेशमेंट मिळाल्यामुळं they can excel, they can do wonder actually. I have that tagline to say every time, we can do wonder. When we are together, we can do wonder. So it is possible. And by these minimum requirements, if we meet with all those things, nurses can do a miracle actually.
Boring like that? Okay. So see, can you hear me? Can you hear me? Okay. See, many of the times, many people will say that we are the shadows of doctors. No, I don't think so. We are shadows of doctors. We can do something. See, I would like to tell some of the inventions done by the nurses. Okay, you may get shocked. See, हमारे nurse ने किया है, क्या है वो भी आप सोच सकते हैं. One is disposable liners for the baby bottles. You know baby bottles ना, baby जब दूध पीना start करते हैं, so air will also enter into the baby, so and it will cause disturbance in the stomach of the baby. So that's one of the nurse what she did. She has found a liner to that people के जो end part में वो liner डालते हैं. So because of that liner, if a baby feed the milk, if a baby drink the milk, then the air will not enter. So that we can predict. So that the invention is done by the nurse. And even you might have heard feeding tubes. The feeding tubes is again invented by our nurse only. Then ostomy bags. Ostomy you might have heard of. Ostomy operation होने के बाद जब ostomy tube को लेके अगर बाहर घूमना तो it causes some smell and it causes some disturbances to the person. So वो समझ के एक नर्स ने क्या किया, अगर उस ostomy tube को अगर एक bag connect कर दिया, so the waste products will go into that bag, so easily patient can roam around, so without causing disturbance to others or even to the themselves. So ostomy bag is invented by our nurse. And even the neonatal phototherapy. You might have seen the phototherapy. हमारे pediatric lab में भी एक डेमो मॉडल है. Phototherapy when the phototherapy machine, before the invention of the phototherapy, nurses ने क्या करता था, जो भी जॉन्डिस हुआ बच्चों को बाहर लेके घूमते थे, बोले तो they were exposing that child to the sunlight. So one doctor ने identify किया, okay, so sunlight अगर बेबी के स्किन पे डाल दिया तो sunlight बेबी के स्किन पर गए तो जॉन्डिस कम हो रहा है. Then that nurse as well as the doctor both to coordinate together and they have invented that phototherapy. Then after the findings of phototherapy, okay, we have reduced the jaundice. Meanwhile, the doctor and the nurses got one more problem that when we keep the baby in the phototherapy, after the continuous exposure of baby eyes to the light, the baby was getting some cases like retrodental fibrosis, you might have heard that disease. तो वो कम करने के लिए फिर से नर्स ने और एक इन्वेंशन किया, that is snuggie baby carrier. Snuggie baby carrier बोले तो it is a type of device. It is like a cap like only. आप लोगों ने देखा होगा कुछ लोग अभी हेलमेट नहीं पहनते, हेलमेट के बिना जस्ट आईज को कवर करते हुए कुछ डिवाइस पहनते हैं. ऐसे उन लोगों ने एक डिवाइस आइडेंटिफाई किया नर्स ने. She discovered and she has made that one and we are some of the hospitals they are using that device. वो क्या करते हैं? बेबी को कैप पहनते हैं, कैप के साथ साथ एक हाई कैप भी है, so that baby will be in sleeping position, so heights also closed, so the baby will not expose to the phototherapy light and the baby is safe with the retrodental fibrosis. So that is invented by the nurse. And even that you might have seen crash cards. So crash card is also invented by the nurse. That is the other idea only. And even that other coded IV lines. So IV lines आपने देखा होगा. So IV lines को हर बार साइज को देके इंसर्ट करना थोड़ा मुश्किल था, इसलिए नर्स ने एक नया तरीका बनाया. वही IV lines को डिफरेंट कलर कोडेड दे दिया. So each के अनुसार so that she can implement it. And one more is baby bonnet and one more is go. ऐसे some many are there. Actually, I have taken only the few of these. So these are the inventions are done by the nurses in association with the doctors, or some of these inventions nurses alone they have produced that one and they have implemented in healthcare system. So we are competent, we are enough competent, we are हमारे पास में brain है, हमारे पास भी knowledge है, हमारे पास भी skill भी है, हम कुछ भी कर सकते हैं. Don't underestimate yourself that we belongs to the we work below the doctors. No, nothing like that. If you people are enough well or enough knowledge, definitely you can do something in the society. That I would like to.
So in our, we know that our nurses, especially in the hospital setting and in the colleges and also, we are working best as a leader, decision maker and a good administrator. So I just want to ask, what are the qualities we have to develop in the nurse? And do you think that our nurses are better involved in the decision?
Am I audible? Yes. When you look at leadership, it's not a position. It's something that each one of us have. The quality is there. We need to just use it. So when opportunities come, for example, if you're working in a casualty, you're a triage nurse. So you're taking that opportunity. When patients come, you're not saying, let's see, I will go. Fine. If anybody calls me, I will go. That's not the response. You're jumping to that and just taking up. And everybody will notice when you're doing differently. You don't have to be asked to do. You are just taking up. Okay, there is a need and you're doing it. And then you become a leader. So it's not something that, okay, if I'm getting that position, I will do, but just looking at opportunities and grabbing it and doing your best. Whatever is your situation, whatever be the case, irrespective of where you are and what you are, you can do your best and thereby slowly you can climb up the ladder. And then when opportunities come to study, use those opportunities, educate yourself, keep learning. That will again help you in your leadership, using that opportunities, leveraging it as a leader. So that will help in being a better leader. And I already told you about the COVID time how we all took it up. It was very, very interesting because we didn't really feel that something was pushed down to us because we were part of it. So the more you put yourself into it, you enjoy the whole career. It's not, right now you must be thinking, oh, I don't know why I took up nursing. I don't like this profession. But if you really look at nursing as a career, there are so many things one can do. Recently, one of my students who passed out nursing, she was telling me, I don't like nursing, so I'm going to do law. I said, wow, it's good. We need lawyers in nursing. What's the advantage? If a nurse becomes a lawyer, they know what are the problems nurses have. The exact things, what is actually happening, how we are treated, or what happens in the hospitals, the interactions, all that will help her to be a better lawyer. Similarly, somebody who loves maths, but unfortunately was pushed into a nursing field, become statisticians. You're working with numbers. Most of the nurses don't like numbers. Yeah? You don't like maths. And then when it comes to MSc, you're like struggling to look at those numbers and do all those statisticians. Take up nurse statistician if you like to become love numbers. That's a career opportunity. So you can take up and grow in that field. You can make a lot of money too, because everybody is knowing. A lot of nurses are doing now MSc, PhD. They all require a good statistician. A nurse statistician is always going to be an advantage. So similarly, those who like research, a friend of mine, we were classmates in MSc. So married, by the time she got children, she found it so difficult to work in a regular college. So she took up this research work. She sits in the comforts of her house and she's still earning. At the same time, her children are also taken care of. So that's the way she's very happy. Recently I heard that she shifted her place and now she's looking for another job, again to do with research. She's not interested now in entering into the regular career, but happy with her research work. Similarly, sky is the limit. There are so many things that as nurses, again there are so many specialties depending on what you like. There are interesting fields that is coming up, AI, genetics. Okay, these are all areas where counseling, again, an administration role. You don't have to be always in the grassroots level or in the bedside if you're not happy. Do what you like, but do it happily. So ultimately, once that passion drives you, then you can grow up in every way.
If I would like to take a reminder of the question, is it like what nurses can do such a things which puts themselves into a leadership role, right?
What are the qualities
Yes.
we need to develop in a nurse?
Yes.
And whether we are getting these chances involved in the decision making.
So when the word comes to quality, it means something to do with the psychology and personality of a nurse. Okay, rather I would like to say that we should possess certain qualities within ourselves so that highlights, that invites, that makes compulsion to the opposite person to invite for the decision making. Understand? So the qualities such as, like, we should be inquisitive, we should be very creative in our thinking, okay, we should be very critical in thinking, we should be a good problem solver, okay, we should be good observer, okay, and we should be, very eager to learn the things. So when you do these all qualities, when we possess, we become ultimately a participant of decision making and so called as leaders. Because if you see in nursing management, there is a debate where the leadership is inborn or it is inherited. It is innate or inherited. So it is a combination actually. काही आपल्याकडे नेतृत्व गुण नसेल तरी सुद्धा आपण नेतृत्व गुण संपादन करू शकतो. त्याच्यासाठी आपल्याला ह्या गोष्टी कराव्या लागतात, जे क्वालिटी मी सांगितले ते, की आपण सहभाग झाला पाहिजे, आपली प्रोएक्टिव्हनेस पाहिजे, ओके, आपली जी मनस्थिती आहे ती खूप झोकून देण्यासारखी असली पाहिजे, त्यात कीन इंटरेस्ट असला पाहिजे. तर ह्या गोष्टीमुळे आपण ते नेतृत्व गुण संपादन करू शकतो आणि खूप काही करू शकतो, जिथं आपल्याला पाचारण केलं जातं की तुम्ही सांगा आता आम्ही काय करू, हे नर्सेसना सुद्धा विचारलं जातं. अशा एक गोष्टी काही अनुभव आहे माझ्यासोबत. ते सायकॅट्रिक हॉस्पिटलमध्ये आम्ही क्लिनिकल पोस्टिंगला असताना जे पेशंटशी बोलणं आणि त्यांना दिवसभर 8 ते 4 मध्ये ऑब्झर्व करणं, त्याच्यामधून जे दिसतं ना, डॉक्टर्स राऊंड्सला आल्यानंतर, म्हणजे प्रायव्हेट हॉस्पिटल आहे तो आणि तिथं आम्ही पोस्टिंगला जातोय, तर डॉक्टर्स राऊंड्सला आल्यानंतर सर काय वाटतंय तुम्हाला पेशंट बद्दल, काय इम्प्रुव्हमेंट दिसतोय, काय प्रॉब्लेम वाटतोय, काय ऑब्झर्व केला तुम्ही, हे विचारून त्यांनी त्यांचा ट्रीटमेंट प्लॅन बदलतात. त्याचा अर्थ काय की आय रिअलाइज दॅट आय हॅव बीन इन्व्हॉल्ड इन टू अ डिसिजन मेकिंग. आता पेशंटचं आउटकम डिसिजन घेण्यासाठी डॉक्टरनी मला पाचारण करणं म्हणजे इट्स अ गुड थिंग दॅट इट इज हिज ओन हॉस्पिटल, ही हॅज टू डिसाइड, बट व्हाय ही इज इन्व्हॉल्विंग मी इन दॅट डिसिजन मेकिंग. इट मीन्स दॅट I shown a keen interest. I interacted with the doctor. Why doctor this is he's having this problem. So when I discussed with him, he invited me. He realized that yes, his contributions are useful for me to bring outcome in the patient. So such things, and even madam also rightly quoted in the before question, like shall we open a hospital for COVID patients? Their director or sir called for meeting to ask for that. That is a shared decision. That is a leader giving an opportunity for the nurse to decide what can we do, how can we do. Okay, so these are the qualities if we have within ourselves, or if we develop केलो त्या qualities ना, तर आपण leadership मध्ये पोहोचला जाण्यास कोणी रोखू शकणार नाही आणि आपण डिसिजन मेकिंग मध्ये खूप की मेंबर म्हणून त्यात राहू शकतो.
See, in relation with the quality regarding the leadership, see, मेरा opinion ये है that everyone have the leadership quality. The first and foremost we need to identify and we need to bring it out. That means हमारे principal usually बोलते हैं बच्चों को छोड़ दो प्रोग्राम ऑर्गेनाइज करने के लिए. कशाला बोलते हो सर ऐसे? Because you people will learn how to communicate with the other members. You will learn how to talk to the other members because many times I see that students will bring the invitation card to me and give it to me. Sir, sign करा. क्यों sign करो? पहले तो तुम्हें explain करो ना. Why you brought that invitation card? You should explain to me so that you will learn how to communicate with the teachers. So this is the invitation card. We are preparing for a webinar. So you please attend for the webinar. Like that you will develop the communication. Communication is one of the important aspect for a leader. मीन्स अगर एक अच्छा लीडर बनना है तो पहले कम्युनिकेशन डेवलप करना है. दैट्स व्हाई मेनी टाइम्स प्रिंसिपल सर विल से यू पीपल टू कम फॉरवर्ड एंड डू एंड शो योर टैलेंट टू अस सो दैट वी कैन आइडेंटिफाई यू पीपल. सो माय ओपिनियन इज अगेन सेइंग दैट यू पीपल हैज टू कम फॉरवर्ड and talk to the teachers, talk to the seniors, discuss with the seniors, discuss with the teachers what all the problems will come when we are organizing something. So if you learn now itself, when you go to the clinical setups or when you go to any education institutions, then it is easy for you people to communicate with others and come forward as a leader. So the best example for me, मुझे तो बहुत अच्छा लगता है. You might have heard that person is Sister Calista Roy. आपने सुना होगा Calista Roy adaptation model. हमारे नर्सिंग में एक बेहतरीन मॉडल है, Roy's adaptation model. Sister Calista Roy was attending one conference. And there in the conference, Sister Calista Roy asked to the presenter, आपके जो मॉडल में एक डिफेक्ट है ऐसे मॉडल के बारे में मैडम ने एक ओपिनियन दिया. She was a student nurse. Then that presenter has shouted her in the conference and उसको थोड़ा discomfort हो गया. On the spot, Sister Calista Roy ने बोला, within 5-6 years I will design a new model. Definitely I will present.